in terms of our nationwide, collectively, we're spending about 17% of our gross domestic product. That equates to $2.4 trillion. 17% of our gross domestic product, $2.4 trillion on health care in this nation. If you go back 15 or 20 years, that number was, as a percentage of gross domestic product, was about half that, between 8 and 9%. So what you have had over the last number of years is a spiraling cost, an increase in cost on an annual basis that exceed 4 to 5% above inflation. And now it doesn't take a rocket science to figure out that economically we can't sustain that. I mean, that is the reason that on every year you see a higher and higher percentage of people, Americans, that do not have health care. That number is about 15% right now. It's in the 46, 48 million range. And it is increasing as a percentage of the population on an annual basis. Now, there are many of us that believe that you never saw a great country that had an unhealthy and an uneducated population. And many of us totally believe in the model, the economic model we have, which is a private sector model, capitalistic market, supply and demand model. But the fact is that if you allow a higher and higher percentage of your population to slip into that situation every year, then you got a problem long-term economically. We can't continue to be the economic leader of the world if we're going to allow that to happen. So we ought to have a debate about how we solve it. Now, none of us want, I don't want a government-run system. I think the very first premise that we start with is that if you enter a plan that you like, you get to keep it. Now that precludes what everybody fears, a government-run single-payer system. So that's important to remember. Two things: increasing cost at 4 to 5% above inflation. That cost number is now 17% of gross domestic product, and you have 46 million Americans, or about 15%, that do not have health insurance. When they get sick, they don't get care. They wait till the last minute. When they're really sick, they go to the emergency room. And if you think you're not paying that cost, then you're mistaken, because we all know we're paying it through higher insurance rates. We're paying it through higher private pay rates. We're paying it through indigent care costs that are picked up by our counties or our cities or our local hospital authorities, whoever it is, which are taxpayer run. So the fact is that we are paying those increasing costs out of our pockets as Americans. Now, we ought to at least concede that we need to fix the system that we have. My idea is, in a very general and macro sense, is to take the good parts of your private sector delivery system and remold those into a system that works and gets everybody into it. The Blue Dogs and myself have, as we peruse legislation and try to help develop legislation, we've got 4 guiding principles, and I want to discuss those with you. I've already discussed a couple of them. Number one is that you have to stop the spiraling increase in annual cost for the healthcare system. You can't continue to have those costs rising as a percentage of gross domestic product each year. So that would be number one. You got to wring the cost out. There are lots of most of us know where those excessive costs are. They're an overutilization. Overutilization is caused by a number of things. You'll get one group over here on the left that says, this is the cause. You get a group on the right that says this is the cause. But the fact is that overutilization is caused by patients, it's caused by providers who are greedy, it's caused by doctors who cause providers to practice, by lawyers who cause doctors to practice defensive medicine. Those primary overutilization costs. And so you got to deal with that. Secondly, you got a good bit of waste, fraud, and abuse in the system, particularly in the Medicare system. And that's very hard to root out, but we have to continue to figure out how to do that. Thirdly, you got excessive administrative cost in a number of a lot of the insurance plans, HMO plans that exist, that people are taking their health insurance through. I'll give you an example. There's a HMO in Tallahassee called Capital Health Plan. It has about, I'm going to guess, a couple of 100,000 members. It's a small, relatively small nonprofit HMO. It has been recognized by CMS and other folks in the industry as one of the best in the country. They have an administrative cost that's lingering right at or less than 5%. Many of your insurance plans have administrative costs that exceed 30%. Now those are dollars being paid by your readers out of their pocket for their health care. Okay? So overutilization, waste, fraud, and abuse, excessive administrative costs. Those are areas that we can work on in terms of cost side. So you have cost, patient choice. That is a key starting point for development of legislation. If you're in a plan that you like, you ought to be able to keep it. Okay? So let's get that on the table to start with. If you're in a plan you like, you ought to be able to keep it. And so excessive cost, patient choice, access. We already talked a little bit about the 46 million Americans who are not in the system, who we end up paying for in some other way. Let's get them into a plan. Let's get them into a doctor regularly. Make sure that they have a primary physician. Make sure they're doing their preventative stuff that all of us that have health insurance plans do on a regular basis. So, and the fourth principle is that, and this is a basic principle for the Blue Dogs and y'all, those who've been in ed board meetings with me before, have heard me say this numerous times. It ought to be paid for. We ought to stop going overseas to borrow the money to do the things that we've need to do in this nation. We're the wealthiest nation on the face of the earth, and we can do this. And so we feel very strongly about that. The Blue Dogs have been preaching this for years and years and years. And our preaching has been falling on deaf ears until the last few months. And President Obama says, I agree with you. We got to do it. We got to stop spending more than we take in. And we got to put the tools in statute to get us there. Now, coming down here, Melanie reminded me that 3 years ago, in 2006, that we had a town hall meeting about fiscal responsibility and deficit spending, and advertised and sent in the newspapers and on TV, and sent little flyers out. We had 20 people show up in Tallahassee. Now, I hope a meeting about health care we probably have. Well, we've got a place that would hold 200 people, and we got people raising cane and saying we ought to hold it at the Doak Campbell Stadium, a football field or something. I don't know. So, my question would be, where have all these people been all this time that we have been preaching about fiscal discipline, fiscal responsibility, which we have? So, again, back to the 4 principles: cost, lower cost, patient choice, access, and deficit neutral. Those are the 4 principles that guide us.